Bone health medications explained. Hi, I'm Dr. Knight, a geriatric and general medical registrar based in London. Welcome to the series where we stop worrying about getting old and just start getting on. This is the bone health series. If you haven't watched the previous videos, then I would suggest you go and catch up on those first, because they gave a bit more of an explanation as to what bone health is and why it matters and why you might need treatment. This video specifically is going to look at the medications that we can use to treat our bone health and to treat something called osteoporosis. So you've been told that you need treatment for something called osteoporosis. So what are those medications? Well, in today's video, I'm going to take you through what medications you might be offered, any of the potential side effects, how to take them, and then how you can be monitored on those medicines as well. As always, I'm using some really reliable resources in order to give you this information, which I would urge you to go and have a look at. So I'm using the Royal Osteoporosis Society, I'm using the National Institute for Clinical Excellence guidelines about bone health as well, and I'm also using the National Osteoporosis Guideline Group. Particularly the Royal Osteoporosis Society has some really good patient information leaflets, so I really would urge you to go and have a look at those. I'm basically just taking all that information and saying it in a lovely short video to you so that you don't have to read them. So just a reminder of why taking medication and having treatment for weak bones might be important. So if you've been told you have osteoporosis, it basically means that your bones are weaker and more fragile than normal. This means that you might be at an increased risk of something called a fragility fracture, which is a break in the bone that can happen with something simple just like a fall. There are actually medicines that can make your bones stronger, and stronger bones hopefully reduces your risk of having a fragility fracture. So what are the main medicines that we use? Well, the main group of medicines that we use are a group of medicines called bisphosphonates. Bisphosphonates are the most commonly prescribed medicine to treat osteoporosis. How do they work? Just a teeny bit of biology. Basically, these bisphosphonates stick to your bones and they slow down the process of bone breakdown because they slow down the cells that break down bone. So the cells that break down bone are called osteoclasts. And the more activity the osteoclasts are doing, the higher the increase the rate of bone breakdown. So bisphosphonates interact with these osteoclasts to stop them from breaking down bone so much. This then helps your bone building cells, your osteoblasts, to work by building up bone more. So basically we try and slow down bone being broken by osteoclasts, and then we encourage bone being built up by these osteoblasts. And this basically makes your bones denser and stronger with time. Now, if that didn't make any sense to you, which to be honest, it probably doesn't because that was not a very good explanation, but if it didn't make any sense to you, don't worry about it. It's technical, we don't need to know. There are a few different bisphosphonates that you can take. The first one is alendronate or alendronic acid. I don't know why we have two names for it, but we do. But essentially that is the most commonly prescribed one, and that's taken as a once weekly medication, either as a tablet, capsule or a liquid. There's risedronate, which is also oral, and that can be taken either weekly or monthly. There's ibandronate, which is a monthly tablet or can be a 3-monthly injection. And then there's zoledronate, which is a once yearly intravenous infusion. Now, the way that we take oral bisphosphonates is quite specific, and that's why I think quite a few people are put off from taking them. But really, if we go through it today, hopefully we can simplify it and make it seem like a less scary process to take the medication. Basically, if you have to take an oral, so a tablet or a liquid version of a bisphosphonate, then you have to make sure that you take it on an empty stomach. Once you've taken it, you have to stay upright for at least 30 minutes afterwards and avoid taking any other food or drink in. And this is for a couple of reasons. So first of all, it needs to be absorbed fully, and if you have any other food or drink or medicines, they might interact with the absorption. So in particular, it interacts with things like calcium and iron, which can be found in certain foods. So in order to get the full absorption and the effect of bisphosphonates, then it's important that you don't have any other food or drink afterwards. In fact, if you take calcium supplements as well, you should wait even longer because calcium really affects the absorption. So some people say if you take a calcium supplement as well, you should wait at least 4 hours after taking this bisphosphonate. The other reason you have to stay upright is because it can sort of irritate the esophagus, which is the food gullet that goes all the way down. So by making sure that you're staying upright, you're making sure that it travels from your mouth all the way to your stomach without sort of stopping off halfway and getting stuck in the esophagus and causing some local irritation to that area. So because of that, if you have, for example, difficulty swallowing or really severe reflux disease or any trouble with your food gullet or trouble with your esophagus, then your healthcare professional might say that this isn't a suitable medicine for you because you don't want to cause any extra irritation to the food gullet. And you also have to obviously physically be able to sit upright or stand upright for half an hour after the medicine. So again, if you're unable to do that, then this medicine might not be right for you. And you also can't take this medicine if you are pregnant or breastfeeding. There are obviously lots of different other reasons, so it's important before starting this medicine that you discuss it with your doctor or healthcare professional. So we've mainly talked about alendronate acid as the bisphosphonate of choice. That is the first line and the medicine that we mainly start with. However, there are a couple of other bisphosphonates that I mentioned before. For example, you might be offered risedronate if you know that you have stomach upset or esophagus problems because it's a bit less harsh on the stomach. So risedronate is the second line if the alendronic acid or alendronate is causing you stomach upset. And then we've got the ibandronate or zoledronate, and these ones are good options if you really can't take anything orally at all because of those problems that we've described, or if patients have compliance issues, so they're really struggling to remember to take their tablets every week because it's a sort of either once every 3 months or annual injection or IV infusion. So you kind of can have it and then just forget about it. How long do we take them for? Well, bisphosphonates don't work overnight, and it's important to remember that you can't feel bisphosphonates working. So you'll probably be taking it and just think, this isn't doing anything for me, but trust me, it will be working below the surface, and you just won't be able to see it. It starts taking effect after about 6 to 12 months, so it's really not a miracle cure for bone strength. You really have to give it time and stick with it in order for it to strengthen and make your bones more dense. Actually, most people are on this tablet or medicine for about 3 to 5 years, and at that time it will be discussed with your doctor or a healthcare professional as to whether you should carry on taking it or whether you should go on what we call a drug holiday. And a drug holiday just means stopping taking that drug for a little bit of time. You might be offered a repeat DEXA scan, so a repeat bone health density scan, which can sometimes be helpful just to assess whether your bones are more dense or less dense. But it's a very long-lasting treatment, and actually once you stop taking it, it still has an effect on your bones for sort of 2 to 3 years afterwards. So it's actually a pretty cool drug. Just a reminder that this medicine does not mean that you will never have a fracture. So no medicine can stop you from ever having a fracture, but it should really reduce your risk of having a fragility fracture. Also a reminder that these medicines do not work to take away any pain in your bones. So for example, if you have had a fracture, so a fragility fracture of the spine or the wrists, and your doctor prescribes you a bisphosphonate, this isn't a pain treatment, it's to help your bones get denser over a long period of time. So you shouldn't be thinking that it's going to take any bone pain away. And just some side effects to be aware of. Obviously all medicines come with side effects, and it's important that you always read the label, discuss with your doctor. But essentially some common side effects are heartburn, bone pain, headaches and constipation. And then there are some much rarer side effects that include atypical fractures of the femur or something called osteoporosis of the jaw. Now these normally occur when you have much longer duration of treatment or with higher doses of treatment. So it shouldn't be something to worry about, but it is something to be aware of. Essentially your doctor will just ensure that you have good dental hygiene before prescribing the medicine. Okay, so what if you can't take bisphosphonates? Are there any other drugs out there? Well, there are a few other drug classes available. I'm not going to talk through them in much detail now, I'll probably do another video about it later, but I'll just give you the general gist of other things that are available. Firstly, there's something called denosumab, which is a twice-a-year injection. There are sort of strict criteria for starting this, and it will be usually started by a specialist. Essentially what it does is it sort of blocks a protein that is involved in the bone breakdown process. The important thing to know about this drug is that if you stop it really suddenly, it can really increase your risk of fractures, oddly. So it's important that if you are started on this by your specialist, you listen to them and take their advice when they advise you to start coming off the drug. Then there's raloxifene, which is a selective estrogen receptor modulator, and this is mainly used for postmenopausal women. We also have hormone treatments, so hormone replacement for women or testosterone for men, and these are obviously when low hormones are part of the problem. And then finally, there are bone building or bone stimulating injections such as teriparatide, and they basically physically stimulate the bone to get stronger. These are really used in very, very high risk patients, or if all other treatments have failed or are unavailable. So again, you wouldn't be starting on any of these without seeing a specialist in bone health. As we know, we can take medicines, but annoyingly, they don't cure everything. And it's really important, if you're prescribed on a medicine, you don't just take that medicine and forget about all the other lifestyle changes that can help with your bone health. Medicines can be really powerful, but they honestly won't do enough if you're not making lifestyle modifications to go alongside it. So that means, unfortunately, doing all the boring things that I've mentioned before in my previous videos, which includes making sure you get enough calcium and vitamin D in your diet or through supplements, exercising, stopping smoking, cutting down on alcohol, and also just sensible things like reducing your actual risk of falling inside or outdoors, wearing sensible shoes, not wearing really long flared trousers if you're prone to a trip, and just being mindful of your environment. Think of medications as just one piece of the puzzle and lifestyle changes being a bigger part of the puzzle as well. Okay, so to recap, bisphosphonates are the mainstay of treatment for osteoporosis, and the main bisphosphonate that we take is something called alendronate. These essentially work on the bones to slow down the rate of bone breakdown and therefore make your bones nice and strong. And nice and strong bones reduce the risk of us going on to have fractures in the future. So they're a really good drug, but they need to be taken correctly. And although what I described earlier of making sure that you take it first thing in the morning with water, sitting upright, staying upright for half an hour, although I know it sounds like a bit of a faff, it's only once a week and it's really important that you take it properly, else it just won't work. And if you're watching this video thinking that they just don't sound right for you, then don't forget there are a whole host of other treatments, and it's really important that you speak to your own doctor or a healthcare professional in order to decide which one is best for you. The treatment usually lasts 3 to 5 years, and you'll be assessed at the end of those 3 to 5 years to decide whether or not you need to carry on treatment for longer or not. And remember, medicines aren't the be-all and end-all. You need to make those lifestyle changes in order to make sure that your bone health is as good as it can be. So if you've just been told that you need treatment for osteoporosis, don't panic. These medicines are really well studied, really commonly taken, lots of people take bisphosphonates, and they really can make a difference to your bone health. And if you've been told that you have osteoporosis or you think you might need treatment, I would suggest speaking to your doctor about the best steps for you. Thanks for watching. I really hope you found this helpful, and I do urge you to watch the rest of the Bone Health series for lots of other top tips about how to keep your bones strong. See you next time.